Let's clear something up. Doctors aren't struggling because they don't know enough. They're struggling because the job itself has changed. Today, a huge part of a doctor's day isn't medicine at all. It is administration, electronic health records, endless notes, billing codes, insurance forms, and the numbers show just how bad this has become. Studies have found that doctors spend almost half of their entire workday on EHRs and other administrative tasks. In one study, 49% of the doctor's time was spent on desk work and screens, while only 27% of the time was spent face to face with patients. That means less than a third in the day is actual patient care. And it doesn't stop there. Doctors are also dealing with information overload. Lab results, medical scans, clinical guidelines. New research being published every single day. No human brain can process all of this under constant pressure. Doctors have minutes to make life-changing decisions while tired, interrupted, and managing dozens of patients. So overwhelm isn't a failure of care or skill. It's a system asking humans to do the work of machines. So when people hear AI in healthcare, they usually imagine robot doctors replacing humans. That's not what's happening. AI isn't a doctor. It's definitely not making decisions on its own. In healthcare, AI is mainly used for pattern recognition at scale. Virtual triage tools already use this, asking patients 10 to 15 questions and routing them to the right care with reported diagnostic accuracy around 75%. It can scan thousands of medical records, images, or lab results and spot patterns that would take a human hours or even days to find. The easiest way to think about this is AI is like a supercharged medical assistant who never gets tired, never loses concentration, and works quietly in the background. One of the biggest ways AI already helps doctors is with diagnosis. Not by replacing doctors, but by acting as a second set of eyes. Take medical imaging. In the fields like radiology, pathology, and dermatology, doctors review thousands of images every year. X-rays, CT scans, MRIs, tissue slides, and skin photos. In skin imaging, AI tools can assess melanoma risk from a single photo with a sensitivity of about 95%. AI can scan these images incredibly fast and flag anything that looks unusual. AI-assisted X-rays, CTs, and MRIs can flag multiple conditions from just a single scan, like lung nodules, tuberculosis, and pneumothorax, with accuracy rates reported as high as 97 to 99%. And this isn't theoretical, it's already happening in real hospitals. At Northwell Health, for example, an AI system helped cut the time from diagnosis to treatment in half for pancreatic cancer scans. Similar tools are now being used to detect lung disease and flag early signs of cancer. Models like Sybil can analyze a single low-dose chest CT and predict lung cancer risk up to 6 years in advance. But AI doesn't make the final call. It highlights areas of concern. It suggests what needs closer review. And then the doctor evaluates everything and makes the diagnosis. Earlier, we talked about what's overwhelming doctors. Now let's talk about what's actually helping. It's AI tackling administration, clinical notes, documentation, coding and billing, inbox messages, and hours spent inside electronic health records. In fact, a study published in the International Journal of Health Services found that US physicians spend about 16.6% of their working hours on administrative tasks alone, time that could otherwise be spent caring for patients. This is where AI makes the real difference. AI tools like Nuance DAX, Ebridge, and Suki can automatically draft clinical notes by just listening during a visit and turning conversations into structured documentation. They can generate visit summaries, assist with coding and billing, and help organize charts, labs, and messages. Some systems can even help prioritize inbox alerts so urgent issues get attention first. The goal isn't to replace doctors. It is to give their time back to them. More face-to-face time with patients. Less time clicking through screens and less mental exhaustion at the end of the day. When administrative work goes down, burnout goes down too. Modern medicine moves fast. New research, updated guidelines, new drugs and interactions. No single doctor can keep all of that in their head. This is where AI acts as a second brain. AI tools like UpToDate, Expert AI, and Clinical Key AI can instantly surface trusted medical research and clinical guidelines right at the point of care. They can support decisions by checking drug interactions and flagging potential risks while helping personalize treatment plans for the patient in front of them. Not by telling the doctors what to do, but by making sure nothing important is missed. Instead of searching through multiple systems, doctors get the right information at the moment they need it the most. And that matters because many clinical decisions are made under time pressure and with limited information. AI doesn't think for doctors, it helps doctors think better. At the end of the day, this isn't about helping doctors. It is about protecting patients. One of the biggest benefits of AI in healthcare is safety. AI systems can help reduce medical errors by catching things humans might miss. In eye care, AI systems for diabetic retinopathy have shown about 90% sensitivity for clinically significant disease. In hospitals today, AI is already being used to detect conditions like sepsis or sudden clinical decline hours before symptoms become obvious. That early warning gives care teams time to act. AI can also support more personalized care by analyzing patient history, vitals, and lab data to help tailor care plans to each individual. In relation to patients' continuous monitoring, wearables and medical grade patches can track vital signs in real time and alert the care teams when something changes so care doesn't stop between check ins. Now for the question that everyone asks: will AI replace doctors? The short answer is no. Medicine isn't just about data and decisions, it's about empathy, ethics, trust, and human judgment. Patients don't just want accuracy, they want to be heard. They want reassurance. They want someone they trust making the final call. AI can process information, but it doesn't take the responsibility. It doesn't understand the context the way humans do. And it doesn't feel the weight of life changing decision. That responsibility stays with the doctor. The future of healthcare is in doctors versus AI. AI is not a threat to doctors. AI is a tool, not a replacement. It's an invisible partner working quietly in the background of every clinic and every hospital. This is medicine done better. At its core, AI isn't about smarter machines. It's about giving doctors back their most valuable resource: time. Time to listen, time to think, and time to care. When doctors aren't buried in data and paperwork, patients get better attention, better decisions, and better care. So, the real promise of AI in medicine isn't about replacing humans, it's restoring the human side of healthcare. Because the best future of medicine isn't AI alone, it's doctors empowered. If you had watched this video till the end, do not forget to like, share, and subscribe. It really supports us. Thanks for watching.